He's a consultant gastroenterologist, hepatologist at Patel Hospital, Jalandhar. Sir is going to speak on assessment of liver fibrosis in hepatology.
A very good evening, everyone. First of all, I would like to thank everyone sitting in the audience to have believed in us and have made it to Jalandhar. Thank you so much for being here. And it's a proud moment for everyone from Digestive Disease Forum Jalandhar that you are all here. So, my academic task is to tell you about assessment of liver fibrosis in a liver OPD, which is a norm now, and without this, the liver OPD will be incomplete. So what are we going to assess? We need to have a replica of these. This is the metaverse score. We need to understand at what stage of fibrosis is our liver patient when he is sitting in front of you, and we need to have something replicating these liver biopsies pictures like F4, no fibrosis, F1 portal fibrosis, F2 when we develop few septas, F3 is septas pre-cirrhotic, and F4 is cirrhosis with nodularity. So this is the gold standard, or I will say best standard to diagnose fibrosis in any patient. But this is invasive. Technology is now FDA approved. What about it? It's a FibroTouch technology, and the usage has keep increasing, and we need to we can keep seeing these technology reports, and we need to equally aware of these technologies, and the reports can keep coming to your chambers. Modality is equally similar to FibroScan EcoSense with stiffness, and but they call it as UAP instead of CAP, and otherwise there is not much difference in both the modalities.
I personally believe that now it is time that we call this FibroScan machine as a stethoscope of hepatologists. So if you really want to practice hepatology in the 21st century, you have to have a FibroScan value and the inputs. Suppose even if you don't have the machine, at least you need to know those values. And in future time to come, with the availability of this FibroScan machine and the values, I think although there is some place for liver biopsy, but liver biopsy is going to go out of vogue, at least for these kind of patients, where you will be able to both detect fibrosis and prognosticate. He showed you data that non-invasive markers, including FibroScan and serum markers, can now predict liver-related outcomes. So I think that is a very important information which he gave.
So, if FibroTouch and EcoSense are comparable in terms of sensitivity, the cost of these two machines is hugely different. So, what is your opinion on that?
So, sir, I am not the right person to answer. So, this is like what should be viable, numbers of Fuji. So, this is not a commercial. So, of course, the technology is there. The people are buying it, and the reports are everywhere. And the users need to answer that question. Whether they lied, I think most of the users are pretty okay with the technology, and if somebody has a cost issue, they should that is his personal choice. But both are FDA approved now, and it's like you choose Color Plus or Denim. We don't know which brand you choose, so it can be like that. But I am not the right person. If somebody is using those technologies, the other one, if he is comfortable with that. But both are FDA approved now, if you take FDA as the gold standard.
There is a gross difference in the cost. So there are many hepatologists or gastroenterologists here who are using the various machines. May I know how many of you are using regularly the FibroTouch? Please raise your hand. How many of you are using the FibroTouch? So 4 or 5. Let us have their opinion. Whether they have compared the FibroTouch with the FibroScan. So that is very important, because if they have compared the two and this is equally effective, then we can say that we can use the FibroTouch. Although there is no head-to-head study published on this. So let us have the practical experience. Yes.
So I have used both the machines significant amount of times, but not within the same patient. Like you said, head-to-head comparison. It's not like I did it on FibroTouch and then the EchoSense machine on the same patient. But my experience has been that the values are almost similar. There might be a difference of 2-3 points. But as a hepatologist, if you are using it in your clinic every day, you must be aware of that. Within that same patient, if you repeatedly use, you will get right results. But if you compare it with a different technology, yes, there is a difference of 2-3 points. Being a clinician, you have to be aware of that.
So I also had a chance of working with both machines when I was in last Delhi NCR. It was all about EchoSense and other machines. So my experience is that when it differentiate between F1, F2, F3, F4, it works right. When it's about F4, like you have cirrhosis patient, and then the reports are mostly 60 kPa, 75 kPa in EchoSense. The upper limit of this machine, the other technology, FibroTouch, is like 30, 35, 40 kPa. But that doesn't matter much. But when you differentiate between F1, F2, F3, that is a good. It is
Right.
it is good.
So between F2, F3, there is a problem. Exclusion of fibrosis, both machines are good. Confirmation of cirrhosis, both machines are good. But if you want to say कि एक में F2 आया, एक में F3 आया, that is possible.